DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today on DocTalk. We have Dr. Christine Navarre, and we're going to talk about parasites and cattle. We're at Louisiana State, and it's just going to be a great show. You got to stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and it's a special day for me. We have Dr. Christine Navarre with us today. She is the extension veterinarian for the LSU Ag Center all across the state of Louisiana, but you're also a professor in the animal science department. If you want to know about parasites and you want to learn about cows and about veterinary medicine and taking care of your herd, this is one of the most tremendous veterinarians in our profession. And she's awfully humble, but if you get a chance to go to one of her seminars, do it. You will learn something, you will take things home, and just appreciate all you do for all of us. Yep, it's great. You bet. So let's dive right into it, because parasites is one of your passions and something that you just spend so much time working on with all of us. You know, where do we start?
Yeah, so I mean, it's a problem on every single operation, and we have to keep track of what's going on. And you know, we've been fortunate that for the last 40 years almost, we've had really great products, but we're starting to see those products, the efficacy decrease, and that's just a biological inevitability, whether it's antibiotics against bacteria or horn flies get resistant if we don't use the products correctly. Same thing is happening on our stomach worms and nematodes. The products that we have out there that have been out there for a long time are starting to decrease in efficacy. And if we don't know that we're gonna have any new products. So we really have to extend the efficacy of the products that we have by changing our practices just a little bit, so that we're still looking at the short term, making some economic decisions, some health decisions, but also looking at the long term and extending the efficacy of these products, and then maybe actually selecting cattle that do well without a dewormer, because we don't know if one day we don't have those products.
What are the products that have the higher resistance issues, or are there certain classes, or is it all just kind of the same all across the board?
Well, there's differences in different classes, but I think the main thing that people need to know is there's no way to predict it on any given ranch. Okay. So I can look at the research that's out there and say, in general, this is what we're seeing. But that doesn't mean that this particular operation has a problem or doesn't, exactly, or the extent of that problem and what products. So at the end of the day, we've got to go back to doing some diagnostics. Just like for every other disease you and I deal with, we base it on testing, and we haven't done that because our dewormers have been so effective. Now we got to go back to doing some diagnostics to really make better decisions based on the knowledge that we gain.
I always laugh because, and my dad, he used to say it was easier to sell a vaccine for a few $1,000s than a diagnosis for a few dollars.
Yes, and that's still the same today.
Yeah, and so we have the tools, we have the technology, we can make some decisions that can not only save money on products, but save money on cost of disease and decrease performance.
Yes.
As you kind of tee up what we're going to do today, what are some of your key take-home points?
Well, I think trying to figure out who needs to be dewormed, who doesn't, and then when we do deworm, what do we need to do exactly, and how do we do that? So those are the things I think that are most important.
If that doesn't get you fired up, I don't know what will. We're going to take a break. We'll come right back with Dr. Christine Navarre.
Hello there, Dr. Nick Wagner, Professional Services with Neogen, and today I wanted to talk about product labels and food safety. One of the first things that you want to make sure you do with injectable products when handling is make sure that you store them properly in order for them to be effective when you go to use them. The other thing is always check expiration dates, because you don't want to use an expired product, because that could lead to concerns with efficacy of the product, could lead to concerns with reactions in the animal, or is also concerned with the regulations from the FDA's standpoint. One of the other things then when you read that label, you want to make sure that you understand what the dose is and how you administer that product, whether it's an intramuscular injection or whether it's a sub-Q injection. Because if you're not giving the injection in the proper location or the proper tissue of the animal, it may impact the effectiveness of it, or the possibility that the body absorbs it differently and potentially could change withdrawal time. That's a concern with potential residues. And then that leads us into understanding and making sure you check the label for the withdrawal time, and then understanding what that is and making sure that it elapses before you ever consider any decisions to market that particular animal. And then one of the last things, keep records so that you know when you gave those treatments, so that again, you're able to respect that withdrawal time. But all of these things come down to making sure that we avoid any residues and we produce a safe, wholesome product for the consumer.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Christine Navarre. We're in Baton Rouge, Louisiana, where Dr. Navarre is the state extension veterinarian and through the LSU Ag Center, and also a professor in the animal science department. We're talking about parasite control, and talk to me now, how do we figure out which cows or which animals need it?
Right. So what we have to think about is that there's resistant parasites out there, and they have genes that carry the resistance, so the products don't work against those. But then we have other parasites that don't have those genes, and the whole idea is if we keep a few of those, I call them the good parasites, keep a few of those good parasites out there to mate with the bad parasites, it dilutes that resistance. So it slows down the progression of that resistance. So the idea there is just not deworming some cows and letting those, the good parasites kind of populate and dilute the bad parasites. So it really depends on a lot of factors. Again, this is something that has to be determined on the ranch, but I kind of like to start with, if you just back off of 10% of your animals, if you just want to get started somewhere. Now, caveat to that is you don't want any other stressors. So the quickest way to have parasites is not have nutritionally managed cows. So if your cows are thin, grass is bad, you want to get those other things, wrapped up. But if we just say, okay, I'm not going to deworm 10% of my cattle, especially cattle that are going on to, continuous grazed pastures, that really gets us a little bit, and then we can go further. So ideally, I would like to take adult cows. They've weaned their first calf. They're nutritionally sound. They should be able to fight parasites on their own. And I want them also, by not deworming them, I'm allowing them to show their true colors. I want to find cows that are heat tolerant, that slick off early, that have good teats, that all of these other things, but I also want them to fight parasites on their own, because I want to then have those genetics long term. So by not deworming your cows, you're letting them show their true colors. We're always going to pay attention to bulls. We're always going to pay attention to those young calves and heifers. But again, if they're going on to permanent pastures, then backing off about 10% is really, really important.
And so, I guess that's what we're saying, is that, you're able to look at their ability to weather parasites. But, when some people say, well, geez, I don't know that I want to, have that go on in the herd. What do you kind of tell them?
Well, again, you kind of have to look at it in a holistic manner. So it's easy to sit here and talk about parasites, but you and I, when we're doing parasite management programs, we're looking at everything. So it has to be done in that context. But just a little bit of change, and people, it's a sliding scale. So you can start, research has shown that if you don't deworm the heaviest in a group of calves, you're really never going to know the difference. And these calves are not going to die unless, again, there's other problems that are really bad. So and then on the cow side, again, first calf heifers, they're growing, they're trying to raise their first calf. I'm going to give them some grace. But once they're adult cows, boy, they need to perform and maintain their body condition without a lot of help.
It doesn't mean take a year off on everybody.
Right. Yes, exactly. Yes. You got to be thoughtful how you go about this. And I'm not going to start, looking at a refugia program or trying to back off if it's the middle of a drought, or, again, you have to be sensible about it. But by changing things a little bit, and then also tracking your fecals over time, I think it's really important to get those diagnostics, which is something we should talk about.
Great. Well, we're going to take a break. When we come back, more on parasite control with Dr. Christine Navarre.
I'm Jeremy McBride. I manage the ranch for Wilmoths here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the paraites has helped us. The last day we got through weaning, it was 65 degrees and sunshine, and the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 head.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Christine Navarre. We're at Louisiana State University, where Dr. Navarre is the extension veterinarian for the state of Louisiana. She works through the LSU Ag Center. She's also a professor in animal science, and she is our profession in the bovine world's go-to person on parasites. And we got her today, so everybody needs to tune in and turn our ears on. So talk to me about, I took some fecals.
What do I do with that?
What do I do?
Yeah. So if you're doing fecals on cows, you really need to make sure they're quantitative. So you need to get them in an eggs per gram. And that gives us a number, let's say 250 eggs per gram. Well, everybody wants to know, I get this call, you get these questions, well, what level tells me to deworm or not? And there is no way to know that. Because those egg counts, a lot of factors go into those egg counts. The immunity of the cow. Cows are going to have lower than calves. But so just one-time counts out of the blue, I can't really tell you a lot. But what's really important is if I have data that is over time. Mm-hmm. So let's say I've got some clients that they're taking quarterly fecals. And I can watch those trends. And I know what their kind of normal fecal counts are. And it may be totally different from the ranch next door, that baseline. But then when I see, boom, things go up, I need to do something differently. And when I have that data, I can make much more targeted decisions on treatment. And I might go from having a bigger group that I'm kind of leaving untreated to, boy, counts are going way up based on historical data. I need to treat this whole group. So just using actual data to make decisions, and not just, well, we're getting them up, let's put a dewormer in them.
Well, and you've taught me this, that the overtime, not all cows shed every day.
Right.
And so you can get some false negatives.
Yes.
And then the type of test that you have run beyond the quantitative is vital, correct?
Yeah, so the mini flow tac is really probably the best one we have for cattle. It's a little bit hard to get. Veterinarians can run those in their clinic. The McMaster test is another thing that veterinarians can run, but it's not as great for cattle because it's better for small ruminants just because cattle counts are lower. But you can send them into most diagnostic labs and get a really good egg per gram. And then we also we're here in Louisiana, so we have, some of our producers have flukes depending on the part of the state. And then, so flukes are an important part of that conversation, whether or not you have them or not, because then that kind of throws a whole nother layer of decisions we have to make.
Yeah, so when we start to think about this and working with your veterinarian and developing these parasite control,
Right.
it goes back to that working with them to develop this time over time, consistent approach to monitoring, correct?
Yes, absolutely. And not just, okay, we're going to do this and we're going to do that for the next 20 years. We need to be ready to make decisions on the fly based on what we know about that individual operation.
It's outstanding. We're learning more and more about that, on whether it's viruses, bacteria, parasites, and much, much more. The future is really going to be fun with our diagnostic capabilities. Anyway, it's great information. Work with your local practitioner. We're going to take a break. When we come back, we'll do a wrap up on parasites with Dr. Christine Navarre. You're watching DocTalk. Thanks for joining us.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Christine Navarre. She's the extension veterinarian for the state of Louisiana through the LSU Ag Center and a professor in animal science, and is one of the best bovine practitioners, period. And she's humble, but glad to have you as a friend, a colleague.
It's an honor to have you as a friend too.
So when we talk about parasites, the question I'm sure you get is, What should I give them and when should I do it?
Yeah, that's the most common question. And, I do a lot of cattlemen's meetings and, I'll tell them I can't tell you that. And then they're going to ask anyway. But the reason I can't say that is I don't know what products work on your operation. I don't know, if we want to do a cookbook, everybody's got to be the same. I don't know what you're marketing. I don't know your other health problems. I don't know your grazing management, which plays into this quite a bit. And so knowing what product and when, for years we were able to do that because the products were so effective. Now they're not, and they're decreasing over time. And so we've got to make some just more educated decisions and not just have that kind of cookbook.
So how would you, if you're working with a herd, what are, obviously the diagnostics and the surveillance, tell me how you kind of then assemble that what and when.
That information. So we're going to kind of look at the goals of the herd and where we are, nutritionally, where we are from a disease standpoint. And then we're going to make some decisions. Some of that's based on the risk of the producer. Some of them have more risk than others, or risk tolerance. Some of them want to go whole hog, and we're like, yeah, let's do it. But then we're monitoring that. Some of them want to go in it a little bit, slower. And we're looking at, again, what age cattle do I have? Am I keeping heifers or not? What type of pastures are they going on to? And then, basically putting all of that together to come up with some decisions. And then we're monitoring that over time. We're not going to say, well, this is it, we're done. Just like any herd health program, it ought to be updated, and we're going to update that on data. So, I may say, hey, we're just going to treat a part of these, weaned calves. We're not going to treat the heaviest and maintain some refugia. And then I may have some results that say, nope, it's time, we're weaning, we're going to have other stressors, we're going to treat every single one of them. So those are the types that can really only be made with your veterinarian that knows your operation.
Yeah, and you're training veterinarians on this all across our country. Mm-hmm. And if you have a veterinarian that hasn't been to one of her seminars or through one of the classes, we need to get them there, because that's really them taking what you teach and what you practice with your clients is the ability to understand the climate, the geography, yes, the grasses, the cows, yeah, all of that, right?
All of that has to be put together. Yeah.
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 And just showing up on the back of the trailer and say, give me that.
Right.
Okay.
Yeah, those days are gone. Unfortunately, we were lucky that we've practiced for many years that way, but it's it's got to change.
So we got about 30 seconds to wrap up. Again, kind of your bullet list.
Yeah, just throw away the cookbook because it's just not there anymore, unfortunately, and work with your veterinarian to come up with, all the things that go into parasite, immunity, nutrition, other stressors, as well as what products do I need and when and in what animals.
That's great. Yeah. Thank you.
All right. Thank you.
Thank you for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm here with Dr. Christine Navarre. I'm Dr. Dan Thompson from Baton Rouge, Louisiana. We'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from a few different companies here and there, but we started working with Bimeda. What I like about working with Bimeda is our rep. He seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Macrocin last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a first pull treatment. It's what really jumped out to us working with Bimeda, meeting with the rep. Macrosin's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. That's something we really focus on, but when you've got a product like a Macrosin, it's just another assurance, protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proven that they're doing the job for us.